Other health news, more than 300,000 Americans will have hip replacements this year. And it's often a long and painful ordeal. But tonight in Lifeline, Dennis Dotis shows us a couple of ways science is smoothing the road to recovery.
You all set?
Yeah, all set. All set, ready to go. Come on in.
In spite of her cheery disposition, 74-year-old Joanne Engstrom has been in a world of hurt.
I've been having a lot of discomfort walking.
But she has high hopes that all ends this day.
I said, if you can be excited about having surgery, I am, because I'm ready for it, and to think that it's just going to be, done the way it's going to be done is really exciting.
So we see a little osteophyte on the inferior neck, so that's kind of what I'm using as my guide.
In less than an hour, Joanne's painful arthritic hip will have been replaced. To make the outcome even better, her surgeon, Dr. Joseph Nestler, is using a computer navigation system similar to GPS in cars. These pins, solidly attached to her pelvis and thigh bones, communicate with the computer. So do infrared sensors reading surgical instrument positions. This precisely lines up the hip socket and the new man-made joint for the most accurate fit possible. And because the doctor will strive to cut very little soft tissue, Joanne should be back on her feet in a matter of days. As often as possible, Dr. Nestler uses a minimally invasive or muscle-sparing procedure. He makes two small cuts, 1.5 inches here, 3 inches here, while the traditional hip surgery involves a 12 to 15-inch cut right down the side, just to fit the replacement parts in place.
Well, if we cut through the muscles, tendons, and ligaments, we have to repair these after surgery. They cause more pain, and they slow the patient's rehab.
Like Joanne, Juanita is also 74, but she still needs a walker 2 months after surgery. The standard operation left her with a large scar and painful stiffness.
That's what the therapy is for. That's what takes the time, and it is still taking time.
On the other hand, the muscle-sparing procedure usually means far less pain, a shorter hospital stay, and remarkable recoveries.
Instead of a walker for a month, they're usually down to a cane about 90% of the patients the day after surgery, and the vast majority of the patients within 1.5 to 2 weeks aren't even using a cane any longer, so their rehab is much accelerated.
But here's the part you got to listen to. Dennis says Joanne's surgery lasts just 49 minutes from the first cut to the stitches. Dr. Nestler estimates that 95% of the patients he sees are candidates for less invasive, muscle-sparing surgery. Anyone wanting more information should go to links and numbers. That's on our website at WCCO.com.